Okay, for today, let's talk about the respiratory system, part 2. And what we're going to do first is go through our list of the major pathology we're going to cover today. So first we have fungal disease, and underneath that we have histoplasmosis. Now that's going to be harder to penetrate, and it is fungal disease, again, from contaminated soil, usually, which can cause calcified lung nodules. So if we were going to take a look at that, we would see something like this. So again, anything calcified on an X-ray image is going to look very bright. So we can see so many little calcified nodules here. They're all over. That's very indicative of histoplasmosis there. The next thing we're going to take a look at is an abscess. This is a little harder to penetrate. An abscess is kind of a necrotic area containing usually pus. Pleurisy next is an inflammation of the pleura. Remember, that's the sandwich of membranes surrounding the lungs. And it can be caused by infections such as the flu or even some medications. The next one is pleural effusion. We'll get to know this one pretty well, even on an x-ray. It's a little harder to penetrate. So again, with all of these so far, we're going to go up a little on technique. Pleural effusion is an abnormal accumulation of fluid or pus in the pleural cavity. Bronchogenic carcinoma is a type of cancer for the bronchioles or bronchi there. And then a bronchial adenoma is a low-grade malignant lesion, and it can cause atelectasis and even pneumonitis. SPN stands for solitary pulmonary nodule. Again, it's a little harder to penetrate, although this one, you probably won't end up changing your technique because it's typically asymptomatic, and it actually usually ends up being more of an incidental finding. Also, because it's just a solitary, so singular nodule, usually like one lesion in the chest cavity, it usually doesn't necessarily take a change in technique. So for that one, let's go ahead and say usually no change in technique. Embolism, let's keep going here. A pulmonary embolism can be fatal. That's when a thrombus, or basically kind of a blood clot, breaks free of the vessel it was in and then travels to the lungs and starts blocking blood flow. Likewise, we can have a septic embolism, and that's kind of a bacterial shower that enters the pulmonary circulation, and then again it gets trapped in the lung. Usually these are referred straight to CT. Atelectasis, we look at some images on that. So it's basically a collapsed lung due to diminished air. ARDS stands for Adult Respiratory Distress Syndrome. Again, you're going to want to go up on technique for these ones. Pneumothorax, it's an abnormal presence of air in the lung. So it's the only one so far in this list that's easier to penetrate, meaning you go down a little in technique. And then finally, empyema is the presence of pus in the pleural cavity. All right, so let's take a look at a solitary pulmonary nodule that I was talking about. Again, see, the only thing we can really see that's different and was probably an incidental finding is this lesion right here. So overall, the chest needs kind of a similar to normal technique. But if you know you're looking for a pulmonary nodule, it's not incidental anymore, you're going to want to probably go up just a little bit on technique. The next one we're going to look at is pulmonary metastases. So this is a cancerous spread into the lungs. And we can see, instead of a solitary pulmonary nodule, now we're dealing with the spread of cancerous tissue. So we see a lot of different nodules all throughout the lung tissue. And then the last one we'll take a look at here is going to be empyema. Again, that's the presence of pus, an abnormal accumulation of pus in the pleural cavity. We can see we have quite a lot of buildup here.